The Gestalt therapy, definition and application. In Gestalt therapy, counselors assume that clients are capable of changing for the better if they are made to understand well what occurs within their environments. Gestalt's approach emphasizes on the client's self-awareness for them to change for the better. The theory's perception of personality has been influenced mostly by existential philosophy. The Gestalt therapy brings out in the open the element of self-understanding and integrates all of the client's ways of being whole. Clients can only be able to make selective choices when their level of self-consciousness is raised. Goals of Gestalt therapy include therapists, enabling clients to assume responsibility of their personal experiences, providing clients necessary skills for the development and satisfaction of wants without interfering with the rights of others, enhancing clients' self-awareness, making clients to learn how to admit responsibility, and making them self-dependent. Gestalt's therapeutic process. The therapeutic techniques in Gestalt's approach are secondary to the establishment of true relationships that allow therapists to challenge clients. According to Freeman, the aim of the therapist is to discern the meaning of the past, present, and the future, accept the freedom and responsibility to act, move toward personal authenticity and become aware of how and when one is deceiving oneself, and release a victim's role for a freer sense of existence. Therapists in this approach apply techniques such as paradoxical intention to encourage clients to show or desire they fear, and deflection which diverts clients away from problems towards something meaningful. Gestalt approach therapists assist clients discern the meaning of past and current experiences so as to help them discover new understandings and options. Shedler describes the key role of the therapist as one that assists clients discover their restricted experiences which hinder therapeutic process. In essence, the therapists aid clients in moving toward accepting their personal responsibility for future changes. Gestalt therapists proceed with therapy by watching and listening to clients as they narrate what it is like in their situation during a therapy session. The therapist does the assessment, diagnosis, and identification through dialogic ways. In their dialogues with clients, the therapist's goal is to assist the client in identifying an experience that heightens their awareness of that experience. Applications of Gestalt therapy. Major techniques and areas the theory is most applicable. The major technique employed in the Gestalt approach is allowing the therapist to work with client to identify salient aspects of individual fields as they emerge from the background. The technique assumes the client is assumed to be capable of self-regulation. The technique allows therapists to identify the most pressing issues, needs, and interests in design experiments that explore resistance to awareness. This approach is based applied in learning processes where teachers work with students to explore and identify salient aspects of their learning abilities. Gestalt theory is a good theory as it has contributed immensely to learning and teaching processes. Other contributions include allowing clients to make selective choices when they become fully aware without interference, letting individuals assume ownership of their experiences, providing clients necessary skills for development for the fulfillment of needs without violating other people's rights, contributing in the development of heightened awareness of individual senses, allows learning to admit responsibility for individual actions, and gets individuals away from reliance on external supports to depend on internal supports. Gestalt theory does not recognize the important role of the therapist as a teacher. It puts emphasis on facilitating the client's own process of self-discovery and teach. Secondly, Gestalt practices place significance on the interaction and dialogue between therapists and clients. This approach can only be functional if therapists have a high level of personal development. This is too demanding for the therapist since he is supposed to be aware of his own needs and ensure that they do not interfere with the client's process.